I think that we're causing more harm because people believe if I just do all the right things, I'll never die. Now, juxtapose that with acceptance. I believe most people misunderstand the idea of acceptance. First of all, it's not a passive process. Just practicing acceptance is not passive. If it was so passive, everyone would be doing it. It's very difficult. It's a practice you have to do again and again. And what I mean by acceptance is that this is what is. I don't have to push it away. And I can, as you said so beautifully, exhale, which means you can also soften your body. And now I can do some work.
So the big question is this. We know spontaneous remissions and so-called miracle cures exist. We also know they aren't so spontaneous after all. I'm living proof of this, having cured my quote-unquote incurable illness. There's something to how this happens. So how do we, as humans with chronic symptoms, tap into this so-called miraculous healing capacity? That is the question, and this podcast will give you the answers. My name is Dr. Erin Hayford, and welcome to the Sacred Illness Podcast. Before we begin today's episode, just my standard medical disclaimer. This podcast is intended for educational and informational purposes only. The content should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare professional regarding any medical concerns. Hi, everyone, and welcome back to another episode of the Sacred Illness Podcast. I am Dr. Erin, and I'm incredibly excited and honored to have Dr. Brad Lichtenstein with us today. Dr. Brad is who got me into mind-body medicine. He is one of the, if not the reasons I am here doing this podcast and doing the work that I do. Had I not come across him in my healing journey and in my work and studies as a student, I don't know where my career would have gone. So it felt very appropriate at some point to get Dr. Brad on the podcast. And so today is the day. Welcome, Dr. Brad. Thank you so much for being here. I am so excited for our conversation today.
Thank you. I'm excited too, and I'm really honored and touched from that intro.
Yes, well, it's no small thing. And I was reflecting back on my days as a student, and we can maybe talk about this later, but just how actually resistant I was to mind-body medicine initially because of how intense it is and how it gets really into nitty-gritty layers of yourself that I had not previously experienced.
It is important to be skeptical. It's important to question because then you can have your experience, which is about what we're talking about.
Bastyr is where I went to school and where Dr. Brad taught and is teaching.
No, I left Bastyr in December 7th, the day before my birthday, 2021.
Oh, wow. Okay, so it's been a while since we've talked then.
Exactly. Yeah, I left
Okay.
after 27 years or so. Yeah.
Wow. Okay. Yeah. So he was the biofeedback teacher and many other things at that time that I was a student, and introduced me to this idea essentially that the mind and body are linked. And it just clicked for me. It was this aha moment. And I think a lot of my listeners know, as I was going through Bastyr, I was also working with my own chronic illness journey and seeking answers. That's essentially what led me to naturopathic medical school in the first place. And it was when I started the biofeedback elective that I had this aha moment of like, this is it. Like, I feel like I'm onto something here. It was exciting and it was like kind of nerve-wracking how right it felt at the same time. So I was very hopeful that I had found the thing. And so I want to just ask you to kind of back it up a little bit and get into just to understand your orientation and how you got into this work. What is your journey? How did you land on mind-body medicine? Did you have an aha moment? Did you have anything where you felt drawn to it? At what point in your studies did this come on board? I don't know the story, and I'm so curious to hear your journey with that.
Thank you for asking that. And it's interesting as we age to look back and reflect. And that's something I ask my patients to do. It's interesting to do that timeline, and I think is invaluable. And the reason I'm saying that is it's interesting to look back at a journal from 20 years ago and hear how you told the story and hear how you tell it now, because memory, people don't like hearing this, is a construct of the present moment. And it's so fascinating when I tell the story and how many things get rote, but how many times they start to change. So I just think about that because I've been reflecting about the year, and I always want to look back at the journey and what influenced me. So there's several things, and I still say them. I categorize different events in my life that had an impact on me. I never wanted to become a naturopathic physician or a physician or do anything in healthcare. I was a young musical theater geek, dancer, singer. That's what I thought I was going to do when I went to college. And that was a shift. When I went to college, Emerson College in Boston, I wanted something to fall back on. So I also studied speech pathology. And I studied speech pathology and audiology and went through their undergrad master program and never finished it. I transferred because along the way, I learned that speech pathologists, even if you have a PhD, couldn't diagnose things. So little Brad had that, like, well, I don't want other people to tell me what to do, which I think is a thought process in naturopathic medicine.
Yes.
So I transferred. That was a long story. Got back into dance, got into the arts again. When I was 13, I became a vegetarian. Backing up a little bit, I was an ovo-lacto vegetarian. I also had severe GI stuff. In fourth grade, I was told I had IBS, ulcerative colitis. I mean, there was a number of things that kept saying, put on medications. I missed almost half the school year in one of those grades. I think it was fourth. Told it was psychological. And it wasn't into college when I ended up in the hospital 3 times that I went to the Harvard bookstore and I found this book, Anna Mae Colburn's Healing with Whole Foods, if anybody knows that one. And there was this whole thing about a lot of people are allergic to dairy. It took me 6 months to get off of it. And all of a sudden, I didn't have GI pain and I had normal bowel movements. What a concept. And so that started this whole thing about natural foods and whole foods. And when I went to Pitt and University of Pittsburgh, I transferred back home and thought I was going to go to conventional medical school. It just didn't feel right. And I heard about Bastyr. All my life, though, even though I was interested in the arts, I was always interested in psychology, in thoughts. There's another part of that journey when I tried to commit suicide at 16, where I was growing up in Pittsburgh, being a young gay man in Pittsburgh. And this was in the early 80s, late 70s. And I didn't know how to throw a football or basketball and thought I wasn't worthwhile, never going to amount to anything. There would be no possibility of finding love. So I tried to commit suicide. The good part of this story is I met a psychologist who told me, you're a Taoist. And I didn't know what that was. I started looking at that. So tying these threads together, I started to learn about the difference between pain and suffering. I started to learn about how our attitudes impact us. And that was a through line through all of this. I was interested in holistic medicine, got really fascinated. So I was going to go to University of Chicago, but wound up going to Bastyr, didn't know anything about naturopathic medicine, showed up. And I thought I was really going to do physical medicine because I had knee surgery and all these other things. I never thought I would do homeopathy. I never thought I would do counseling. And that's what I did. But then I started working in HIV care. And I did some HIV work before I went to Bastyr too, but that's the most profound thing. I don't know if I can say most profound thing. The other stuff was fundamental because back then we're talking about 93, 94, we didn't have medications that we had after like 95, 96, 97 that changed people's disease. So a lot of the people that I worked with got a diagnosis and they were told they had 2 to 5 years to live. And this is why this is so profound, because we did all the naturopathic things. We took all the herbs, we took the supplements. They might mitigate side effects. They did. Actually, I do think green pharmacy does a lot to mitigate side effects from synthetic medication.
Yes.
It kept some people alive longer and helped them have less suffering or pain, but the patients died in the end. And so this is what flipped things for me. I was still interested in all these nutraceuticals and supplements and diet nutrition, but the real conversations were, how are you living with this? I've said this story so many times, but that's the only question I ask people now. The main question. All the other questions come from it. How are you living? How do you want to live with this? And I worked with hundreds of people who couldn't get away from it. They weren't going to get rid of it. You know, it's changed since. In the late 90s, a huge change happened. And I even worked with some people who said, you know, I was waiting to die and now I'm not. And I don't know how to live with that.
Wow.
So that really, I would say that was one of the most profound things. I worked in the Bastyr Integrative Oncology Center. I did a research study with them as well doing guided meditations. I went to the bedside of hospice patients twice a week doing guided meditations, did over 500 bedside hospice meditations. Those impacts really shifted me, and I just kind of said, I don't want to do the supplements anymore. I don't want to do any of those. I know that they work. I know they're helpful. I know diet and nutrition is really powerful. Believe me, I know that. I don't care about that anymore. I want to talk to people about like, how are you living with this? And then 20 years ago, I got into biofeedback. And I love that simply because it was a tool of making the unconscious conscious to people. I thought that was an interesting device, but I don't even do much of that anymore. It's more about helping people feel into their experience. I taught a number of things at Bastyr. I taught in every department, but where I really am comfortable with is talking to people about their chronic pain, their suffering, their chronic illness.
I think it's incredible how these seemingly little pings, they're just like little nudges that push us down this path and we could never know where it's going. But when you add them all up, it gets us to where I think we're supposed to be. When we just keep following those nudges and those intuitions, we end up kind of settling into the space of like, who and how are we supposed to occupy this lifetime? Like, what is our medicine? What are we bringing to the table? This concept of acceptance was the theme of something you've been sitting with a lot lately and have arrived to in your own work. And it feels like an inevitable place. If you're consciously paying attention to the work you're doing, there has to at some point be an acceptance of, yeah, these things can only take you so far. But like you said before we hit record, we're all going to die. Things do eventually end. And culturally, we're so focused on like biohacking and anti-aging medicine and, all these things where we're focused on how do we keep getting bigger and stronger and healthier and better, like as if there's some, I don't know, some perfect place of arriving in health. And I think it's a distraction, right? It's a distraction from what's uncomfortable and what's painful and the fact that we're all going to die no matter what. And so, sure, if that's what helps you get through the night or whatever, but I think there's so much more peace and freedom. When I think about acceptance, I think of exhale. Oh, okay, I can just be with what is. So yeah, can you speak to what you see with the people you work with this lack of acceptance that is rampant everywhere? What are the conversations you're having around that right now?
That is the question. Thank you for bringing that up
Yeah.
and saying that, because it is, and you touched on everything. I'm not on social media, and I don't want to vilify all of social media. I know social media has been very helpful for some people finding more information, for finding community. My read of it, though, I feel that social media has amplified that perfection notion that you're talking about. Now you can find all the biohackers. Oh, we can go into that. I think naturopathic medicine, I was saying to you before this, I think that naturopathic medicine, holistic medicine, biohackers, I think that we're causing more harm because people believe if I just do all the right things, I'll never die. Now, juxtapose that with acceptance. I believe most people misunderstand the idea of acceptance. First of all, it's not a passive process. I don't mean once you do acceptance that you're passive. I mean, just practicing acceptance is not passive. If it was so passive, everyone would be doing it. It's very difficult. It's a practice you have to do again and again. And what I mean by acceptance is that this is what is. I don't have to push it away. And I can, as you said so beautifully, exhale, which means you can also soften your body. And now I can do some work. Acceptance has nothing to do with liking or not liking. And then we embrace that. We accept that we don't like this or we like this. But then we soften, we breathe, and we can get into how that regulates the nervous system.
Yes.
But regardless, it's just that I don't have to exude all this energy to fight something. And now I can do something. So when I talk to patients with cancer or Parkinson's, or when I talk to the ones with early dementia, you can expend less energy and accept it. Now, what do you want to do? You might still do that trial. You might still try those supplements, but you're not clinging to it in such a way that you're harming yourself. And I agree with you that a lot of the messages out there, if you just do this, because now everybody needs to do psychedelics and everybody needs to do breath work and everybody needs to wear their Aura ring. And so many of my patients I've gotten to take off their tracking devices. There's a lot of research coming out now that people who wear those tracking devices have worse sleep because they're anticipating more sleep. I love when people tell me my Aura Ring said to me that I'm not sleeping. It's like, did it? So my conversation is with people saying, how do you want to be no matter what? Václav Havel has a quote in Czech, but the translation is, we don't do things because they'll turn out a certain way. We do things because it's the right thing to do. So what I would say in that, I'm not taking these supplements because I'm hoping it's going to change everything. I'm doing it because I'm exploring how it will be. I'm seeing if there's a benefit. If there's a benefit, I'm going to keep doing it because it's my value. The right thing to do is the value you have. And I think the number one, to jump into the next part of that, the number one dis-ease we have is being productive. If I do, and I know this personally, but it's if I do more, then I'm worthwhile. If I do more, I'll be safe. And it's, can you do some of those things and breathe and soften? Do you need to do those? Are you worthwhile without doing those? And most of the people I work with are struggling with, I'm not good enough because I didn't do anything. From my patients with intense diagnoses who say, I'm not worthy because I didn't help out around the house, or I can't be at parties with family for a long period of time. I'm not good enough.
Yeah.
This is not to say to anybody listening, you just need to pull yourself up by the bootstraps and ignore those messages, because good luck. Those messages are everywhere.
I talk a lot on here about subconscious programming and how it's automatic. So we just, until or unless you stop and examine and look at it, you think it's just how things are, right? Because it's just how your brain is instructing you to respond or to show up in the world. And I really love what you were saying, this idea that we are so focused on getting those metrics or getting those calories or getting this much sleep or getting symptoms. Like, we're so focused, it's like a dangling carrot. We're just not alive now. We're missing everything right now. And yeah, I feel like that's how so many of us spend our entire lives, is just trying to get to that thing. And then we're 2 weeks away from our death and we're like, what did I do with my life? How did I even live it? How do you be with it? How do you live with it? How can you be in relationship with it now? I've been using language in my one-on-one sessions, something similar to that. How can you relax around it? This idea of, if there's something, a pain in your body, we often tense around it just on a physical level. And that is going to obviously not only make you more uncomfortable, but it's sending more signals to your body that this is bad, this is bad, this is bad. And it's creating more and more and more tension. And so it's more about, how can we accept that it's uncomfortable, but relax around it. So just give it space to be there and to show up. And as we do that, oftentimes in my sessions, as we make space for it, it does start to shift. It doesn't always go away. It doesn't always get better, quote unquote, better.
It shifts, is what you say. Everything's impermanent. Most of the time I talk about, how do you want to breathe? How do you want to breathe into it? Because most people, again, statistically, I would say most of my people with whom I work are orienting to that mobilization, right? Got to do more. I rarely meet people who do the opposite of complete collapse, but I do work with a number of them. And for them, it is a threat. So that's why they collapse, right? But they also have to say, okay, it's safe enough to take a breath. You do have to relax the musculature. So I try to come back to the body, because people say, how do you let it go? What does that mean, let it go? Think of that fight you had. Are you tensing anywhere in your body? If we had enough biofeedback sensors, we could show you.
Yeah.
Most people aren't aware of their thighs or their feet. So many times I've been saying to people, since all my work is virtual, are your heels off the floor? Are you like starting gate ready to go? And surprisingly, a large majority say, yeah, I am. Where are you going? Like you said, we're not here. And so it's like, what would it take just in this moment to put your feet on the floor, whatever you're feeling? And this came home to me because I think it was around the first wave of vaccinations for COVID. And I did get my COVID vaccine. And for the first 12 hours, I was like, I'm not going to have side effects. This is fantastic. And then, like, hour 25, bam, I was in bed, fever, I had a headache. And there is some new research shows that your expectation about those side effects impact your immunology and your immunological response. If you see them as beneficial, not only do you have less symptoms and severity, but it actually seems to confer more immunity for longer. Interesting. So expectation, attitude, which is what we've been talking about. But I remember sitting there and I go, okay, I know the breathing to cool down my temperature. I'm doing the same thing we're talking about with everybody else. If I breathe this way, the temperature, it wasn't working. The pain was intense. It was really a bad headache. And I was trying to do that. That wasn't working. I was nauseous. And then I thought, oh, this is where I am. I'm just going to breathe into this. I don't like it. Of course, I don't like it. I know that this is going to help confer more immunity for me later. But I'm like, right now, I'm in bed. I'm not seeing patients. I'm not working. I can't even watch movies on Netflix. I'm under the covers. My cat's coming and saying hi occasionally. This is where I am. So I just like be here in this moment. And then I, as you said, relaxed into it. So that secondary suffering. In Buddhism, they say the second arrow. You've got the pain, but then you shoot an arrow at it about, what does this mean? I'm bad. I got to get rid of this pain. I didn't like it. I wouldn't wish that on anybody.
Yeah.
And when I did that, I fell asleep. I woke up 3 hours later, had the same pain, did the whole cycle again, tried to get rid of it. But then when I like, oh yeah, remember. And so the pain didn't go away. It lessened a little bit, but all that secondary suffering of the tension and the tightness was.
Hey, Sacred Illness listeners, Dr. Erin here. I'm quickly interrupting today's episode to put out the invitation to you or anyone you know who has a chronic illness or chronic symptoms that would like to come onto the podcast and share your story. Our goal is to invite folks onto the show who have worked with mind-body medicine modalities and noticed an improvement or even a complete resolution of symptoms using this potent medicine. If this describes you, check the link in the show notes below that will take you to a quick application to fill out that will give us some information about who you are, what your story is, and we'll take it from there. And again, if you know anyone who might also fit this description or like to come onto our show, please feel free to share the link with them as well. All right, let's get back to the episode. Yeah, it's understandable because we're wired to react poorly to pain and discomfort. And then there's the cultural conditioning saying symptoms are horrible, illness is horrible. It's that idea of like, got to get away from it, which then is that secondary arrow of fueling the fire, creating more of a fight or flight response in the nervous system, which is not going to help anything.
We all say about get away from the tiger. Is there a tiger? If I'm thinking about taxes or elections or any of that, those are real things. We're not denying any of that. Then the question is, okay, right now, is there something I can do about it? That's the acceptance. If there's something I can do about it, then do it. If there's nothing I can do about it, ruminating isn't helpful. How many people have you worked with who, when you say something about affirmations or mantras, they poo-poo it? We're practicing mantras every day. We're practicing affirmations every day when we go, I'm not good enough. I'm not good enough. I can't do that. I can't do that. So you said something earlier about your narrative. We do not have the respect for cognition as a practice. I work with a lot of people in tech who they get the message, I want you to take time for yourself. You really do need to take time. Can you get that done tomorrow?
Yeah.
And I read another article. It was an article about in companies, teaching people about resilience can actually be cruel. Because what you're doing is saying, oh, you individual, this cog in the wheel, if you're resilient enough, you can deal with the 80-hour work week they're telling you to do. Or maybe it's not even 80, 50, but take time off for yourself, but get that done today.
Yeah.
And so what they were saying is we need to look at the system and the systemic damage, and we're directing the blame on the wrong anchor.
It's like adding yoga on top of 80 hours of working as if that's gonna fix it. It's like, no, add yoga and subtracts 60 hours, maybe we'll see a difference. That just goes to illustrate what we're talking about, is this idea of just keep pushing ahead, just keep adding more, do more, do more, do more. If you're not getting the results you want, do more is the message. And that's the American way. If you're not taking on all these things and you have failed and you are weak and you're not resilient, when we are having those stories of lack of worth, that's what drives us to do more. But that's the root of it to begin with. If we felt worthy, we could just exist. We could just be with what was. We could just accept ourselves for who we are. So it's this vicious cycle where a lack of worthiness, a lack of enoughness, whatever those stories are, whatever that programming is from most likely childhood, comes into play and pushes us and pushes us and pushes us. I keep seeing these memes that are like, I'm supposed to be picking berries and laying in the grass with my friends and not working 60-hour work weeks. We're not meant to live the way that we live. And then we wonder why we're sick. And I think we're starting to understand more and more why we are so chronically ill. But the antidote that we're giving is adding a yoga class or telling people to work on their resilience, but we're not changing any of the underlying factors, which is not going to bring us the shift we need to see.
And we talk about, I do too. I talk about meditating every day. And somebody says, oh, I've got another 20 minutes to do of something. And I really am clear about that. It's like, I don't want you to think I'm giving you another thing to do, because what it is it's a practice. And if you're doing that, you're not doing something else.
Yeah.
But if you're just adding it on, don't do it. Formal practices, which are really important about learning a new skill, any new skill, what you like, knitting or drawing or anything that you've done, playing an instrument, you've learned it. You had to practice formally. What's more important is, how does it generalize into your daily life? How do you sit down to your computer and every time you look at your texts and emails, you go, and you do that for 45 minutes.
Mm-hmm.
That raises your blood pressure, raises your heart rate, and then you wonder, why don't I feel well? When we talk about ergonomics, I'm here at this standing seated desk and I have this thing, it's on a stabilizer. I have to stabilize myself and I have this up at a certain level. When I don't use this, I can't breathe, I get tense. And maybe it's not because I'm stressed. The point of the ergonomics is, how do I change my lifestyle to fit my needs? One of the biofeedback practitioners I know used to say, don't adjust your posture for the environment, adjust the environment for your posture. But we don't do that. It's like, oh, I'm in this little cubby, I got to do it this way. But I think that's the essence, is that's what we're doing with everything. And people don't like when I say this, but you can't do it all. You can't have it all. I don't know what it all is.
If you're so tired and unable to be present to it and enjoy it, what's the point? The need to work and make money is not the problem. It's the way in which you're engaging in that work. It's how you are approaching it, how you're living your life. In every micro moment of your life is how it's going to be overall. I think that's one of the most potent things I learned from our work together in biofeedback, is how you don't even have to be psychologically stressed. If your body is hunched over and you're not breathing and your muscles are tight, you're sending a message to your system that you're not okay and you're not safe. I think most of us are chronically low level stressed anyway, just because of how life is in general.
We're always accessible, always checking things. The rate at which things are coming at us, we're being bombarded about so many things. And so many of my friends will talk to me like, oh, I got to take a news fast, media fast. I actually am not an advocate of that. Because I don't think it's the absence or the presence of news that's the issue. I think it's how we're orienting to news. Yep. So if I am doing it and scrolling and need to find more and need to find more, that's the problem. Now, of course, I know if you don't have a physical newspaper anymore, you're on a device that's designed to keep you engaged. So I know that you're already fighting a current.
Yeah.
So for some of us, we can't do that. So yes, the media fast will be good. But if we can develop a different attitude to it, I want to learn this. This is how I want to do it. Like, I remember my father would come home and he would read the two newspapers, and that's what he would do before dinner.
Mm-hmm. That was it.
And then it was done.
Yeah.
And we don't do that because it's always accessible. We can find out anything, anytime. You have to identify, what do I want my relationship with this to be? And how much time am I going to dedicate to that? And then the honest question, do I have the resources right now? Do I have the resources right now to actually do that? Because if I don't, then avoid it.
Mm-hmm. I think that is the hardest lesson for us to learn, or for reality for us to face, is being mindful of everything you just said, because I think it's so easy for us to just pick up the phone. It's just what we do. But what is the intention? What is it doing for us? How is it adding to us or subtracting from us? Have you heard of that metaphor for folks with autoimmunity, the spoons? Like, you only have so many spoons.
Yep.
And you give them away.
I use that all the time.
So it's that similar idea. If we're constantly giving away energy or joy or attention or whatever it is, if we're just constantly giving those away, we're emptying our cup and we're not refilling it in ways that are meaningful. What you're saying is such an important message to just continue to reiterate. It's not about just cutting it out, because that's the medicine approach. Just cut it out, just suppress it, cut your body part off, whatever the problem is, just get rid of it so you can keep going. It's not about that. Certainly, sure, there are moments where we just need to get rid of the pain. Like you said, if you just need to have a media fast, do it. Generally speaking, how you do anything is how you do everything. And if you don't have a relationship with discomfort that allows you to make space for it and move with it and allow it to be there and accept that it's part of life, then yeah, it's going to be a constant struggle.
How have you done that? I'm curious, how have you, that very question
Mm,
of how you do everything, how do I want to do everything? How have you been applying that in your life?
yeah. Yeah, that's a good question. So I don't know if you know that I have 2 children now because you're not on social media. So
I'm not.
yeah, I have a
Congratulations.
3-year-old. Thank you. A 3-year-old and a 4-month-old. And the
Wow.
yeah, the 3-year-old is in the throes of just tantrums, very intense behavior, expected normal developmental behavior, but it's bringing out everything in me. It's testing all of my skills, so to speak. And so it really has illustrated how easy it is to go back to old ways of being because I was defaulting to more unconscious ways of being reactive. And so it's really, this is just an example of how it shows up in my life, but it's forcing me to slow down and to first of all accept that his behavior is what it is. And I can't just change it. I can't just make it stop, because that's what my system wants. I want to be like, stop screaming. Just don't ever do that again, please. It stresses me out. It's not going to happen, right? So I think initially that was an energy of just like, oh my God, how do I just fix him? How do I make him stop doing this? And so I had to come around to accepting that this is the discomfort in my life right now. I love him more than anything, and he triggers me more than anyone. It's this like incredibly intense juxtaposition. So it's like the test of all tests, right? To learn how to be with that and to just accept that that is what it's going to be. And instead of him going away, which I wouldn't want to happen, I need to learn how to be in relationship with it differently. And it's a work in progress. I'm not even close to where I want to be with that yet. That has been a big deal for my husband and I too, to have forgiveness or to hold it like acceptance. Like, okay, today was okay. I felt skillful. I felt embodied. I felt more present to this stressor. And the next day, maybe not so great, but it's allowing things to just be in flux. And that's hard. I'm curious for you too. How does that show up in your life?
I love what you're saying about with your children, because I think relationships are one of the more triggering things for all of us. And some people say, I'll just not be in a relationship.
Yeah.
And good luck. I mean, some people can. To piggyback on that, I mean, you just addressed everything we've talked about today. And you're talking about also the fundamental belief I have that all of our emotions, all of our reactions are conditioned.
Mm-hmm.
I don't care if you want to take a contemplative approach to it or a affective neuroscience perspective. Lisa Feldman Barrett, who talked about how emotions were made, talks about this, but it's like we have an experience, something happens, we hear something inside or outside, and then the brain makes a prediction. And it's trying to be efficient. That's the reason, right? So we make a prediction and then we keep those predictions going. And the minute we make a prediction, it sends a simulation down to the body. Just like if I imagine biting into a lemon, because I've had a lemon, I can make a prediction what it's like, I start to salivate. This happens to all of us. We make these predictions based on our conditioned responses. So to talk about my relationship, and my husband's listening, he knows I talk about this all the time. I know I was raised by Judy in McKeesport, Pennsylvania, and I was the baby of 4. So the best. Sorry. but the baby of 4, but my mom had 4 kids and she would have signs on the refrigerator, please close the refrigerator door, the management. Put the dishes in the dishwasher, the management. And being the snarky kid I was, I would say, I don't know the management, Mom. Who's the management? But I did it. I mean, we learned how to make our bed before we went to first grade. Now, not everyone in the family did these things, but the point was I was conditioned. I always thought that's what people would do. When I went to college, I thought everybody cleaned their bathtub and sink every day after they used it.
Wow.
And it wasn't until I lived with my first partner that I realized people didn't do that. So the point is, my husband will put a dish in the sink. I'm like, can you put the dish in the dishwasher? Can you just, or he'll take off his socks. He knows I tell everyone about this. He'll take off his socks and put them by the coffee table. There'll be a pile of socks at the end of the week. People will say, if you loved me, you would do this.
Yeah.
It's easier with a 3-year-old, a 4-year-old, a 2-year-old, even 12-year-old, a 16-year-old. It's like their brain's not developed yet. But with our loved one who's an adult, we go, don't you know, we've talked about this. What I practice, this is my mantra. I say, that's his neurobiological adaptive response. He's conditioned to see it that way. And I'm conditioned to say, he's not listening to Judy. But he wasn't raised with her. So that gives me pause. And I go, this is my conditioned response. And sometimes I do pick up the socks and I put it right in front of his office door. And I say, that's what you're doing. Okay. Because, if I didn't have sleep, if I ate something that had dairy in it, there's so many factors that will affect that reactivity. But like you, I'll say, hey, I was less skilled today. I was more skilled today. What can I do differently? And that's the thing. That's learning. That's part of the practice with people in my life. Like, even, friends don't text me back about something. I go, why didn't they? And I was like, how many times have you not texted people back? Because you forgot all kinds of things. And I practice owning that.
I always think of it as little nervous systems ping-ponging off of each other. This is my program meeting your programming, and these programs don't fit very good. But if you can take that perspective, it really helps to take the edge off of things.
What I heard was, this is my nervous system and it's reacting, and this is your nervous system reacting. Many people I hear say, well, mine's the right way. Or maybe we just can't. But you said it takes the edge off. So it's recognizing that then there must be another step, that you're having yours, I'm having mine. And then what do you say to yourself?
Well, so if it's my husband, for example, because that's a good example always, I think in those cases, it helps me to move into a place of acceptance, of just saying, this is who he is and how he's showing up. And the next step might be, okay, I'm going to go calm down or take what's mine and go sit with it or something for a minute. And oftentimes in the moment, maybe not the most skillful, right? When everything's escalating, but usually there's a moment of reflection afterward of, you know what, it's really not that big of a deal. A lot of the times it's recognizing how that program just created this big response. And it's important to recognize that is fight or flight. You're saying this thing is a threat to my way of being in the world. And so I'm either going to fight it and destroy it, or I'm going to run away from it. But either way, we want to conquer it. We want to overcome it. That's the fight or flight response. It's that, gosh, what is his name? Viktor Frankl?
Yeah.
Between stimulus and response, there is a choice. You can insert a pause between those two things. You can make a choice of how you're going to respond. And in there lies all of your freedom.
The language I'm using now is that prediction. You're making a prediction, and you said that thing about safety. I use the word safety, like my identity, like you said, this is my identity. If you're challenging that, that's not safe.
Yeah.
And I'm curious if you also seen this, that some people, not everyone, but some people do that with their diagnosis.
Yes, 100%.
That this is who I am and don't even challenging it. And it's the attachment, like you were talking about before, of holding on to that identity. It's not safe if that gets challenged.
When I step into that kind of mindset, again, it's that idea of relaxing around it. So much space opens up, and it's saying, this is my automatic response. This is my programming. I can work to get to know it and to maybe rewire it or reprogram it, but I'm going to relax around it so that it feels like it has breathing room. Because ultimately for me too, what I'm recognizing is when I get triggered or when these things come up, there's an inner child or there's something in there that's hurting or feeling like it needs to be expressed, or it's unseen, or there's a story in there of I'm not worthy. So it's something in there that needs attention to. What is in me that's being triggered that needs to be attended to?
And assessing that, because we also have to acknowledge there are real life threats. I said something about the tiger and how many of us have the tiger, but how many of us have, whether it's from their health diagnosis, whether it's, we could talk about any of the world news events right now. We're not saying don't mobilize, don't run.
Right.
So you get a diagnosis and say, okay, what do I do about that? It's an immediate life-threatening issue. We take action. If we have an acute threat, the building is shaking, I'm going to run.
Yes.
The question is when it's more an existential threat, it's not an immediate threat, you don't know what to do. Is there a way to reframe the threat to a challenge? I want to be like some of the EMTs I know, that no matter what's happening, they still take action, but they relax into the action. Can I breathe into it? As you say, is I can relax into it. And I hope that helps create that framework. We're triaging. This is an immediate threat. What do I want to do? This is less of an immediate threat, but it's something I want to address. But can I soften into it so I can see clearly? Because the other thing is, as you were talking about that fight or flight response, your prefrontal cortex, a lot of your clear thinking is offline.
Yeah.
So we're not trying to tell everybody, oh, you need to be calm and peaceful all the time.
Yes.
There's times to move.
Yes, that's like spiritual bypassing. It's saying if you're doing it right, you're calm all the time, you're peaceful, you're one love, everyone and everything, blissed out, whatever it is.
I love my cancer. I love the flooding.
Yeah,
Yeah.
and that's part of acceptance is, like you said earlier, it doesn't mean you have to like it or want it or any, right? It's just, it exists. It's real. This is a thing that is in my life. That's acceptance. And I think any form of bypassing, spiritual bypassing or suppressing, that's not what we're talking about. It's different from acceptance. Hi everyone, Dr. Erin here. So by now you're starting to get an idea of some of what the sacred illness paradigm is all about. The sacred illness paradigm is all about this question of what is your illness inviting you to become? What is it that lies within each of us that allows some of us to acquire so-called spontaneous healing or remissions? And what is the key to unlocking that innate self-healing capacity in each and every one of us? The Sacred Illness Blueprint is something that I developed as a guide to help you walk through this process step by step to learn how to move deeper and deeper within yourself to find these layers of dysregulation, of trauma, of limiting beliefs, of things that you're holding within your system that are keeping you small, stuck, and sick. Ultimately, if we ignore the mind-body connection and are not exploring the ways in which our nervous system continues to be dysregulated or in a chronic state of activation and stress, any healing modality that we put into our body from the outside in is going to be less effective, if not effective at all. So if you are currently feeling stuck, lost, confused, or disillusioned in your healing journey, feeling like you have tried so many things, you have tried so many modalities, you have worked with so many providers, and you're just not seeing the results you want, know that this is normal, and of course you're not, because this foundational mind-body connection is often, if not always, missed in all of these modalities. And just like we can't build a house on top of sand, our healing cannot grow and blossom and be strong and successful if the foundation is not laid first. So rather than doing something different but similar to everything you have tried before and expecting different results, I encourage you to consider doing something different altogether. This is where I invite you to explore the Sacred Illness Group Coaching Program. This is a low-cost monthly membership option that I have created. It's constantly open, constantly enrolling, where you can begin to explore this completely different way of engaging in your health, in your body, in your illness, and in your healing process. What is provided inside this group coaching program is the blueprint that lays the foundation and lays the path out for you to follow to begin to explore these deeper aspects of health, to truly get at the root of what is causing your illness, and from there allowing all other modalities to blossom so that you can actually start to see the changes and the healing take place in your body that you have been expecting and wanting all along. If you're ready and want to learn more, head on over to aurorasomatic.com, and at the top of the screen, click on Group Coaching, where you can read all about it and become a member today. I can't wait to see you on the inside, and for now, let's get back to the podcast.
And I think that we haven't, I don't know what you think about this, but I think that there's somewhere we've got the message that if something's uncomfortable, we should immediately get rid of it.
Yeah.
I know when I used to teach chronic pain classes, about chronic pain, not how to have it. But one of I can't remember the researcher, he talked about integrative and naked pain. And the example he gave was the farmer, the factory worker, they come home at night, there are aches and pains, and they said that's part of their life. So they're not suppressing it. They go, yeah, that's it. I'm going to take a hot bath. Yeah, it's part of, and their relationship to it wasn't debilitating. Whereas naked pain is, this is pain is bad, I got to get rid of it. The paper that I read about this was saying bare aspirin, the advent of aspirin was really good because what they said, good for marketing, is you got pain, we can take it away, take it away, take it away. So there doesn't seem to be space or training around tolerating discomfort.
I think that's the paradigm shift that has to happen, because how would that shift medicine in general? If we shifted the way we're approaching it of just get rid of it, get rid of it, get rid of it. I use this phrase, we're missing the medicine. This podcast is called Sacred Illness. So the idea is there's a message here. The pain, any discomfort has a message. And if we just rush to get over it or to bliss out over it or whatever it is, we're not getting that message.
And true transformation If you take the Jungian perspective, if you take Joseph Campbell, it's never going back. I used to teach a class at Bastyr. I don't know if you ever took it. It was a class called Myth, Ritual, and Healing.
Oh man, no, I would.
It was my favorite class teaching. What we talked about is all illness or all dis-ease or illness in mythological terms. There's three parts. There's that separation, like today I'm invincible. Oh my God, I got this. And then that separation immediately plummets you into the wilderness and you don't know where you are. And that's what we have to tolerate. Being in the wilderness is okay. And so many of us don't like it. It's uncomfortable. And I'm not saying we should stay there. But then the transformation, the re-entry is not going back to this one. And so many people tell me, I just want to go back to this. And it's like, then there was no learning. And I don't know where I land personally about it all happens for a reason. I think it happens for cause and effect.
Mm-hmm.
And I will never impose on anyone else that this is the reason you have this illness. But what I will say is, what do you want to learn from it?
Yeah.
I mean, that's up to you. That's completely up to you.
My Crohn's disease journey and your illnesses, your digestive issues. I've been working with this idea of wounded healer. It's either you take that wound and learn how to make medicine with it, or you can get stuck there. And I think going back to what you said earlier about folks who need their illness to, so to speak, or need their symptoms as part of identity, I think that's where people can get stuck there because they're needing that for safety, for identity, to receive care, to get things they never were able to get.
To say no.
To say no. Yeah. To set boundaries, all those things, right? I use the Joseph Campbell hero's journey a lot in my work, where you get to that bottom part of the circle where that's the choice point, right? Either you go forward and come back out transformed, but you can't go back. And I think that's why we get stuck in illness, because it's like, this is all I've ever known. This has always been my life. This is how I've always shown up. These are the relationships I've always had. I don't want to give this up. This is everything to me. And even if we know consciously, yeah, it's not the best, and maybe I could be happier, but it's what I know. And so I think that's where illness, I think this is what I was trying to say earlier, is illness is protective in that way because it's helping us stay in that life. And we don't want to move into that other life where if we suddenly made space for the pain or had acceptance around the pain and discomfort or learned how to expand around it, then suddenly there's space for us to become someone else. And I don't think we always want that. There's fear there. There's resistance there.
I used to teach yoga. I used to be a yoga therapist. I used to teach yoga therapy classes at Bastyr. I used to be a professional dancer. Before that, I don't do much yoga anymore because of my knees. And I was just doing something this morning. And I was like, oh my God, I can't do this. And that could be, wow, with curiosity, I can't do this. Isn't that interesting? Or is it, oh, who am I? Well, I used to be this way. Now it's not, this is bad. If you want to live long, you have to exercise so much and you need to be able to do this and that. I was like, wow, am I going to shame myself? The answer is yes, I'm going to. But it's so fascinating to watch because it shows up so many ways.
It's not always this massive death and rebirth that's happening in these cycles. It can be these little micro moments like you just described, where anytime we're met with discomfort is that choice point of, do we want to allow ourselves to change and orient to the world in a different way to allow this new layer to be who we are, or do we want to resist it?
I love that choice point. I love that you said that, because that is the action there. It's a choice point.
Which is the Viktor Frankl thing, right? Between stimulus and response, we have that choice point. I'm curious if there's any stories or cases from your own work. Is there anyone that comes to mind when you think of someone who has allowed space around discomfort and what that led to for that person?
One of my patients in hospice. She was the very first person in the hospice study, and she didn't die when the hospice study was ended. And I said, you're ruining our data. That's a joke I said. And she laughed, but she was the happiest person I ever knew. So I just want to mention this. She did not get out of bed. The whole time I knew she couldn't get out of bed. They had to do pulleys and all of this stuff to get her out. She congestive heart failure and a number of things. It took me several months to get her full diagnosis because she was so skilled at turning around and talking about you. And not because she was bypassing, she was just so interested in people. And even though she had all these health issues, she was always saying, what exciting thing's going to happen to me today? Who's going to walk through my door? She had 8 kids in 10 years. During the study, her eldest, who was 50, had a cerebral aneurysm while he was repairing a roof, fell off the roof and died.
Oh.
And everyone said to her, oh, you're going to start grieving. Like the social worker that came in for hospice, like, you're going to start grieving. And she said to me one day, what does that mean? Because I think about him every day. And then she said, I don't know how to be sad when I'm appreciating the 50 amazing years I had.
Well,
This was not a show. This was not contrived. She wasn't trying to bypass. I met a Buddha. That was a message I keep hearing. No matter what happens, how do you want to celebrate all the things you have?
yeah.
I know, tell somebody in excruciating pain that. I don't tell people that, but that's something I'm remembering, for me. Things aren't going to happen the way I want. Look at the world. It's not happening the way I want.
Yeah. I think what's interesting is despite her being able to approach life with that expanded way of holding space, she's still sick. She's still dying. Life still is happening.
Had a bunch of cardiac symptoms, heart symptoms.
Yep. Right. So I think that's the most maybe uncomfortable thought that we're introducing in this episode is you can do all the right things and still be sick. You can do all the right things and not get well. It's more about, and I kind of mentioned before we started talking about my definition of health is wholeness. You make space for all of it, be with all of it, the good, the bad, the ugly, and just move and expand and contract as needed, but doing your best to maintain this space of acceptance and mindfulness and approaching it from that place, I think is, if nothing else, it's going to give you some freedom and some peace of mind, maybe around what it means to exist. We are a little overzealous with our fight or flight response. As a species, we're like, I don't like that. That makes me uncomfortable. I'm going to limit your life. Every little thing that makes us uncomfortable, we have this massive response. And as we're saying, triage, if it's truly, truly, truly threatening you, sure, yes, a response is appropriate. However, there's so much nuance between that response versus everything else. So can we expand to the other side?
That's where the practice of meta meditation, loving kindness meditation comes in for me, because I practice having meta loving kindness for all kinds of world leaders.
Mm-hmm.
But as the Dalai Lama even talked about, that meta meditation is wishing that the person feels safe, healthy, at peace, at ease, because I believe if I'm at safe, healthy, happy, and at ease and at peace, I'm not going to do half of the reactive behaviors I do.
Yeah.
So if I could really feel safe when my husband leaves his socks there, it doesn't trigger that. I know that sounds like a benign thing, but it really, everyone knows in their family. It's like, why do I get so frustrated? It's like, if I felt safe, I would just look at it, pick it up, put it away if I wanted to. So I know if it's that small and it goes that big, that everyone's responding. This is the belief. Everyone, even the doctors who dismiss patients, they feel like that's what their job is. They need to be safe. So if everyone felt safe, they would do different things.
Mm-hmm.
Not necessarily my things, but different things. And I don't believe they'd be violent.
I had forgotten about loving kindness. I think you might have introduced me to it. I know I learned about it when I was in Seattle. It's a beautiful practice, and I will put a link if people aren't familiar, unless you have one that you love to use.
On my website.
There we go. Good transition. Yes.
The breathspace.com. I do live stream meditations every Thursday at 8 o'clock Pacific time, and those are free. I've been doing those since the beginning of the pandemic. So I've been doing it every week, every Thursday morning at 8 a.m. And we go through a number of different practices. So they're all mindfulness based, about being present, stabilizing our attention, but loving kindness is there. And then I do have several for free. People can sign up to the library, and there's just a ton of other ones that I've done before that they can have access to. But I think in the free one, there is some loving kindness meditation. I learned this not in person, although I've taken classes with her, from Sharon Salzberg. She has amazing loving kindness. There's so many of them out there.
Yeah.
But it's just to remember, it's never about condemning and condoning an action. It's not saying this is good action or bad action. They're saying this person is doing the best they can. How many times have we said that the person's doing the best they can with the resources they have?
Yep.
But it's really embodying that.
Yes.
And the hardest part is to ourselves.
For us. Yes, it is. It is. And in that space is where freedom lives, right? When we can slow down and create that space for ourselves and that awareness and forgiveness for ourselves. Yes, that's where.
Choice point.
Choice point. That's the word. So you
Yeah.
just mentioned that thebreathspace.com is your website. And what, aside from your free offerings, which are incredible, and I didn't know that about Thursday, so I will be seeing if I can log in and join you on some mornings. But what else, how else can people work with you, get in touch with you, see your work, etc.?
So my practice is all virtual. So I see people all over the world. I tell them I'm not working as a naturopathic physician. I'm working as a coach. I know life coach has been so overused, but I am a coach. I'm a guide. We're in a collaboration. My first session is talking about how do you want to live no matter what comes up? What is it? Of course, I'd want you to sleep more and have less pain. Those are the side effects. What we're talking about is if that's happening, how do you want to be? And for many people, when we start to do that work, those side effects change. Not all of them, as you know. So people can book sessions online. I do online sessions. I have the guided meditations. There's a library of meditations. I also have some other classes for biofeedback. People interested in biofeedback practitioners, for practitioners only. People can sign up for my newsletter, which I do intermittently. I also do death cafes. And I'm going to do another one this October, I think in maybe December, I'm not sure. I used to do those in person, and those are just a virtual offering where we gather together and we talk about issues that arise about death.
Mhm.
Everyone can come as
Yes.
long as you're alive. It's for everybody. It's not about needing to have a diagnosis, needing to have lost somebody. Always different. I've done 50 of these now. Sometimes I've had 60 people. Sometimes I've had 5 people, and it will morph.
Mm-hmm.
I've also had climate cafes where we gather to talk about the same, because I see those as the same thing.
Mm-hmm.
Death cafes and how do we sit with all of this? So
Yeah.
people can go to my website, they can look at the events, they can sign up for a newsletter, and people
So
can just email me too if they have any questions.
awesome. And that is, I assume your contact info is on your website as well.
It is.
Okay,
Yes.
excellent. So I feel like the appropriate way to sign off our podcast, well, first I want to say is it's been an honor to see you since it's been, I guess, a long time since we've talked. And like we were saying, it doesn't feel like that long, but here we are. It's been almost 10 years since I was a student, which is hard to believe. So I haven't seen you in person since then, which is not okay. But anyway, it's been such an honor. And again, I owe so much to you. I mean, who knows if I would have stumbled upon this at some point, but it was not just like anyone can teach biofeedback. It was the way in which you taught it, the enthusiasm, the energy, and just the way that you got us thinking about it. And it's something about it just really, it changed my life. And it changed not only, professionally, which obviously matters because the work I do, I think is important and needed, but personally, right? My health journey, like I am symptom free. I am one of those people whose symptoms did resolve through doing mind body work and being with my body and creating space. So, for that, I owe you so much thanks. That words could never do justice. The gratitude that I have for you being on my path. And especially now that I know you're not at best year, I'm grateful that the timing worked out, that I got to be with you while you were there. So thank you.
Thank you for saying that. I appreciate that because we often don't know the impact that we have.
We
And
don't.
even when we hear it, sometimes it doesn't register.
Mm-hmm.
And I'm going to say this in all sincerity. You don't know the impact you've had on my life. Any professor, teacher, I believe, gets so much from the people they work with. And I think of this as you are part of my healing journey. It gives me so much. Even this conversation gives me so much. And I appreciate and am so thankful that you're doing this work and that you were in my path as well.
Thank you. I'm like, okay, we gotta log off. I'm gonna cry, and no one can see that because that's my thing.
Own those tears, cry.
I know. Let it out. I was going to say, I feel like the appropriate way to log off is the mantra that you said to all of us. I don't know if you still say it, but
Yes, I do.
can we say it together? May you go gently knowing
knowing your
your
goodness.
goodness. Thank you.
Thank you.
Thanks so much for tuning in to another episode of the Sacred Illness Podcast. If you find this information shared here inspirational and educational, please share it with those you think would benefit from this work. To take this work deeper yourself, check out our website, www.aurorasomatic.com, where you can explore our coaching, community, and course options. And don't forget to subscribe to this channel where new content is coming out all the time, intended to inspire, awaken, and help you deepen your relationship with yourself, your life, and your world. We'll see you next time.